The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. With us, we have a well-known, one of San Diego's most popular cosmetic surgeons, Dr. Maurice Sherman. Dr. Sherman, welcome to the program.
Hey, thanks, Randy.
Now, mommy makeovers, hot topic. We invited you to come on the program. In fact, I've been trying to get you on the show again for at least a couple of years.
That's
so
true.
Glad you came down. Okay, now, what type of procedures? I mean, who's your typical patient? I guess you see everybody.
Oh my gosh, we see everybody from some pediatric cases. In fact, just the other day we did a otoplasty, an earlobe reduction on a 8-year-old, and all the way up to, I think the oldest we've done is in the 80s.
What is the most popular procedure that you do?
It varies. I get asked that all the time, by the way, but it varies according to the month or maybe the season. Obviously, before the summer, we'll do a lot of body contouring work, liposuction, breast augmentation, tummy tucks. During the fall of the year, we'll do a lot of facial stuff because facial work such as facelifts, laser peels, etc., because of the fact that people are trying to get ready for the holidays. And of course, throughout the year, we'll do things like injectables and aesthetic care.
Now, I interview, our program airs throughout the U.S. and Canada, and I don't think there's a facial plastic surgeon that I've talked to that doesn't know who you are. I mean, you're a well-known person. We should talk a little bit about your background and training. Triple board certified, both in cosmetic surgery, facial plastic, and head and neck surgery.
Correct.
Is that correct? On all the programs, I always say, I don't endorse the doctors on my show. In your case, I do. In fact, my fiance needs a small procedure done. I could send her anywhere in the country. And I told her she's got to see Dr. Maurice Sherman. So
well, that's
good.
very greatly appreciated.
And that's true. And people need to know these are real interviews. I mean, this isn't rehearsed. In fact, we didn't go over really anything that we're going to talk about today, other than I said, let's talk about mommy makeovers. So let's define that first. What is a mommy makeover?
Basically, it refers to multiple type of procedures that we do to help make a mommy usually several times over, into a more attractive person, a person who feels better about herself because of, unfortunately, some of the bad things that have happened to her body secondary to the pregnancies. And those usually consist of course, the tummy tuck, but it also can consist of liposuction, especially in the hip and love handle areas. There's also breast augmentation, very, very commonly done with the mommy makeover because of the changes, and we can talk about that
later. I've
later.
seen your photos, and some of them truly are extreme makeovers. It's about, and one of the things you're telling me off camera is you say, Randy, for certain people, that if they don't like their body, it holds them back. Elaborate on that.
Well, obviously, one could see in some of the pictures, some of the examples we have are patients who really don't have terrible bodies. Most of us, or a lot of us, might not even think of as being very, very significant, such as looseness in the lower abdomen, stretch marks. But that's enough to maybe have a very healthy, vibrant young lady who's in her early 30s never want to go out on the beach again wearing a two-piece. And that's the type of patient that we can certainly help.
What do they tell you, by the way? Okay, so they've had pregnancy, they go on the consult. What are their concerns? I mean, what do they ask you? What are the frequently asked questions?
Well, the biggest one is that these things are concerning me. I don't like to show my husband. I don't like to get undressed in front of my husband anymore.
Interesting.
I don't feel as young. I don't look as young as I feel. Is a very, very common comment because of the fact that obviously they still are working out, they're exercising, but some of these things they can't get rid of.
On a consult, by the way, and do they bring, let's say a woman, do they bring their partner, their spouse, and do you encourage that?
I encourage it because I want all questions answered, and I want all concerns. In fact, the guys usually come in, the husbands come in and say, gee, I love Mary just the way she is. Why are we doing this? I don't understand it. Is she looking at other guys?
So the guys actually try to talk the spouse out of it in certain cases?
A lot of times, yeah, they do because again, they want to, I think they want
Well, they want a natural look.
They want a natural look. They're afraid,
maybe
perhaps, that things are going to get worse.
Yes.
But number 2 or 3 is that they think that if they mention it to their wives are going to, it's going to compound
it is
the
insulting.
problem.
Right.
Yeah.
And okay, so they're in on the consult. Now, I've asked this to other doctors, but as an artist, and by the way, do you consider yourself an artist?
Absolutely, yeah.
Do?
You have to understand the the human form, how it works, what looks pretty, what looks aesthetically pleasing.
Do you see that end result? I mean, they're on the consult, and gravity has taken its toll, pregnancy, et cetera. Do you see the end result?
We certainly can.
I mean, do you, though, in your mind, do you say, oh boy, this is going to be good?
But absolutely true, and that's when we need to tell them that they're an excellent candidate for whatever we're talking about because the potential is there. However, there are some patients who don't have that potential, and we can improve them to some degree. So it's important that they have realistic expectations, and all that's part of the consultation.
We're moving on to the photos. So what are we looking at? Now, these are all mommy makeovers for people just tuning in. Okay.
Well, this is a very, very typical patient, Randy. This is a lady who is in her mid-40s, maybe early 50s, and she's noticing that her breasts are starting to show lack of volume and drooping.
I mean, is this true no matter what? I mean, every woman, because it's fatty tissue, I mean, it's going to drop.
Well, certainly it's fatty tissue that's going to involute or atrophy, and it's also the glandular tissue that as one gets older, because of hormonal changes, will start to also shrink or atrophy.
Okay.
So a combination of those two things will usually lead to loss of volume, especially in the superior aspect of the breast.
What does that mean, the top part of the breast?
The top part, above the nipple, and then, of course, the drooping, the sagging of the entire breast tissue. So, this is a typical type of patient. A lot of patients have these type of problems, and even though it looks very, very complicated, it's pretty routine and pretty standard that we can get some really excellent results with this type of appearance.
So that abdomen, what's going on there?
So as we move down to the abdomen, you can see this is a very, very typical type of situation that we see,
really, that's
every
normal.
day.
I mean, that's typical.
Oh, it's very, very common, very typical, but of course nobody usually sees it because these people want to hide this particular part of their anatomy, because even to their husbands, they don't want to undress in front of them. Oh, absolutely, all the time, because of the fact that they think this is ugly and unattractive.
So with that wrinkly area, so with the tummy tuck, and I'm not sure I understand exactly how the tummy tuck works. I mean, you're taking it out? What are you doing?
Right, well, it partially, yes, but what a tummy tuck refers to, of course, is tightening the tummy, and that means the muscles, it means the fat, and it means the skin, and it also means treatment of the belly button too, because that's a very, very important aesthetic part of a tummy. Okay. And so with some of the newer techniques that we're doing now, we can do a lot of aggressive liposuctioning and contouring of the abdomen, as well as skin tightening, muscle tightening, and rebuilding the belly button.
So it's a combination. This is this Avalar. Am I saying it right?
Correct. Avalar abdominoplasty.
And that's, for the most part, new.
It's
where
relatively
you're doing lipo
new.
and tummy tuck together.
Well, the best part about this technique, of course, obviously, is the fact that we get great results, great looking abdomens with nice contoured tummies. But we also get our patients up walking much, much faster. We eliminate a lot of the complications of the older tummy tucks.
Could they go on a Friday, theoretically, and return to work Monday, Tuesday of the next week?
Well, probably.
You don't like them to do that.
Probably by, it depends, of course, what kind of job they're doing, but usually by Tuesday or Wednesday, in other words, 4 to 5 days, they're going to be able to come back to a sedate type of office job without any problem. So I want you to look now at her afters, and you can see in the breast area, she has more fuller breasts. They're perky, and yet they're natural. They're not overdone. They're not too large. In other words, she still can wear normal clothes, and people won't look at her or double take at her and say, oh gosh, she obviously had something done. So we just want to rejuvenate that area into
Well, it looks like she got her
look.
body back, by the way. When I look at these before and afters,
Well, basically, she
doesn't look like the same person.
She absolutely feels like it, yeah. And look at her tummy too. The after her tummy, it's
huge
nice.
Difference.
It's shaped now. She has a nice smooth abdomen. And look at her belly button. Her belly button looks normal. It doesn't have to look distorted. And also, of course, you can't see the scars because they're placed very, very low.
You say you like to put your incisions low.
Absolutely. You want to try. In fact, we tell patients bring in their low-cut bikinis or whatever garment they want to hide the scars, because there are scars, but these scars will continue to improve with time. But anyway, the point is we want to hide them as low as possible so that they feel they can put on as intimate type of clothing. So now, when she goes out, she can wear these nice, tight-fitting clothes and look great in them. She doesn't have to worry about any type of bulging, about holding her tummy in all the time.
Yeah, that flat stomach, by the way, is a fit look. Sexy at any age.
Absolutely.
Obviously.
Yeah. And,
without sounding superficial, I mean, it's a good look.
Even without even wearing clothes, and then of course, if without clothes on in a two-piece, it's going to look even better.
So those stretch marks, I mean, that looks, my guess is about, am I about right, about that much? So you took out about that much?
We usually go a little bit above the belly button. So we're looking at, now in a patient like this, the actual size is probably no more than about 8 to 10 inches, but you can stretch that skin and that it'll be much bigger than that, because you can imagine what that tummy looked like when she was pregnant. So that's one example. And then we have the fitter patient, the patient who is in good shape, who exercises and still has that saggy stretch mark type of skin
after pregnancy
in the lower abdomen. And this is an example of that particular patient. And you can see that in the pre-op picture.
Now, most women would want that body.
Yeah, but what was bothering her and what you can't see on these pictures is this significant amount of stretch marks that she had below her belly button.
Okay.
And that's what really bothered her. She couldn't wear two pieces. She didn't really want to even show her husband her
Do they say
figure.
that really? I mean, I've asked you that before, but I mean, do they bleed their guts on this?
Well, we hear that. We hear that time and again.
They're that self-conscious.
Yeah.
Okay.
And that's really, we don't think of it, but and we don't think of why, because the husbands certainly come in and tell us, gee, that I love my wife regardless, but to her, in her mind,
so a very
this is
fit
a very,
person,
very big deal.
Very fit person. They get stretch marks. So what do you do?
So again, with this particular patient, she doesn't have much fat. Liposuction is really not an option anymore. She needs to have that skin lifted and tightened. Okay. And we do that with the tummy tuck, again, hiding the scars very, very low so that you basically can't see them in a normal type of garment.
So that's the after, because, you know, obviously going into this interview and I think about tummy tucks, I think of a much older person. This looks like a very young person. So those stretch marks are gone, and incisions are low. They can wear bathing suits.
Incisions are low, and again, you can't see it in those pictures, but the belly button also looks very, very natural. So a lot of problems have arisen in the past, and I think in the public's mind, about the scar around the belly button. And that's one thing that we take great pride in trying to create a very, very natural.
So mommy makeover. Do they come in sometimes saying, I need a mommy makeover?
Well, in the last couple of years, they sure do, yeah. And I think it's because of these
And you're the mommy makeover guy, though, in San Diego, some people say.
Well, you know, I think we do a great job with them, and we have very, very happy patients.
Okay, good. What else are we looking at? You have some more for us.
And this is also a very, very typical type of patient. And you can see that she has not necessarily a terrible figure, but that before picture, that sagging and largeness of the abdomen doesn't look good in tight-fitting clothes. And especially when she bends over, it's very, very difficult for her to hide that.
So after pregnancy, so I understand correctly, okay, so the abdominal muscles themselves get stretched out a little bit?
Get stretched out.
You sew those back together? Like the six-pack I'm talking about?
Correct.
So
those muscles are like this in youth, and as we have babies, and of course with age, they tend to stretch and separate. And what we're doing in the midline is to suture those muscles, actually the fascia.
So you bring them back together.
We bring them back together again, and we can bring them back with different degrees of tightness also.
But it doesn't happen to every woman. Why is that?
Boy,
I guess that's a big question.
I wish
but it doesn't happen
specifically. But I have seen patients that we're seeing them for other things. For instance, the breast situation, where their tummies look pretty darn good, even after 2-3 babies. So, fortunately,
So with this
doesn't happen to everybody.
This woman's not a liposuction candidate.
Well, she could have had liposuction, but if she did, she would have still had that sagginess to her abdomen. She would have still had the hooding and the stretch marks, the hooding around the belly button. Okay. So, yeah, she would have been helped with liposuction, but I don't think that she would have been happy. And that's the reason why, when you go see somebody, a physician to evaluate, to have that consultation, it has to be more than just a liposuction doctor. The doctor has to be able to handle all sorts of situations.
To do both the tummy tuck?
Correctly, yes.
And to get a good evaluation. Okay, so with her, what did you do?
So with her, we did that Alvarez abdominoplasty, where we were able to liposuction, contouring the fat, then we were able to mobilize and tighten the skin and remove the excess skin, rebuild her belly button, and also produce a very, very defined sculptured appearance to the abdomen, as you can see, and also the scars.
Like a fitness person.
Well, like somebody who's been working out for years. Now, she is a good patient, and she does go and work out, but we just enhanced greatly what she was able to do on her own.
Does this give them leverage to start work? I mean, do you see that they start eating better, exercising more when they get these procedures?
Sometimes it's almost like a new person who comes in. They're taking care of themselves better. They have new hairdos. They're wearing clothes that they never thought they could wear. And of course, their personality is much more jovial and ebullient.
Really?
So, it makes my heart very gladdened to see those type of changes.
Big boost in self-esteem. Okay, we're going to take a quick break. We're going to move, I guess, to other tummy tuck photos and also breast lifting. Also, you brought some breast implants. A lot has changed there.
Correct.
Is that right? Okay. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're discussing mommy makeovers. Are you a candidate? We'll be right back. You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. What can be done and how to get your body back with triple board certified cosmetic surgeon, Dr. Maurice Sherman. Okay, Dr. Sherman, you have a lot more photos.
Yeah, I don't know whether we have time to look at all of them, but
all right.
But here's another typical example of what we see: a relatively young lady who's in relatively good shape, but has had several children, and she is left with this bulging, saggy lower abdomen.
A lot of stretch marks here.
And a lot of stretch marks, yeah. And if you would feel her tummy, she probably has some separation of those muscles in the midline that prevents that abdomen, no matter how much she works out, from getting real tight and firm.
Are there any statistics on how many women after pregnancy, get this stretch mark look? I mean, is it 1 out of 5, 1 out of 10?
Well, unfortunately, I think it's definitely at least 50%. I would say somewhere about 60 to 70%. So one could say that pregnancy is not really great for a woman's body.
Mommy makeover, we're talking about after pregnancy, breast lifting or augmentation.
Correct.
Or maybe even a redo of their breast. Tummy tuck lipo with this new technique. Okay, so with this woman, what did you do?
Well, again, with this lady, we were able to tighten up the tummy, correct her muscles, eliminate that saggy, stretched skin because it's never going to come back. Hide the incisions very, very low in the abdomen so that she can wear.
That's a perfectly flat stomach, by the way.
And give her a flat, tight stomach like she's been working out, or at least it'll stimulate her to continue to work out and to remain healthy for the rest of her life. Okay, Randy, what we have is another mommy makeover, and again, we see that the fact that her tummy has somewhat ballooned out, and no amount of exercise is going to get that back. And in fact, in clothes, again, she has that predominance there that really bothers her. So with the type of techniques we discussed, we were able to give her a flat tummy. And then if we look at the breast, you can see that she was developing some fatty fullness in the breast that, in other words, she felt she was too big and too heavy in the breast tissue. So we're able to do a lift and reduce at the same time some of her fullness. And we're able to bring her back to a more proportional look to her entire body so that everything now looks fit together and her clothes look great on her. Okay, so here again is some more breast that we normally see after several pregnancies. And this is a deflated breast that what we were able to do is to just augment that breast and get her back to where she was, not making her bigger, but just back to where she was before she became a mommy. The other patient is a patient who comes in after several pregnancies and after breastfeeding, and she has a lot of drooping to the breast. She hasn't really lost, she's a young lady, so she hasn't lost that much tissue, but she's droopy. And for that, we were able to do a lift procedure.
Now, these are minimal incisions. I mean, you don't really see the incisions, but you go through the nipple area. Is that right?
We go through, when possible, we like to hide the incisions around the nipple area. We can also hide them in the inframammary crease or fold, which is underneath the breast when we can. But sometimes in the lifting area, we have to do some further incisions, but almost all of them will continue to look better with time. And, I've been told that these type of incisions look a lot better than a big, saggy, droopy breast.
Now, the implants, you brought implants, and we're just about out of time. What's changed there?
Well, we have, of course, the old saline implants, which didn't have a great feel to them, but which was the only thing that we had available. And in the last couple of years, since November of '06, we have now approved and completely safe and effective these silicone gel implants. And you can feel that the feel is a very fleshy, normal feel. And most of our patients now prefer those type of implants. We have different sizes. They're so-called high profile, medium, low profile to fit the individual patient. And even the newer implants, the gummy bear implants, which
Hey, what is this? You get a lot of questions about these gummy bear implants, you say.
well, we do. They're called form stable implants, which means that you can't compress them. One of the advantages is that the fact that you can use them on top of the muscle, and they're also good in revision cases. But one of the disadvantages is that you have to use a much, much bigger incision to get them in.
Okay, now, after pregnancy, what's the number one fear? A patient needs a breast lift. What's their number one fear? Is it the incisions, the scarring?
Oh, I think if they need a lift, they're concerned about the incisions, because in the past, the only incisions available was what we call an inverted T or Weiss incision, anchor incision, and that left a lot of visible scarring. And now there are lots of different techniques where we can avoid that. There are better ways to even treat the incision so that the scars, if you will, heal much, much better and much less offensively. In fact, look very, very good to the point where you can't even see them.
So there's a lot of technique. I mean, where do you go to learn? Maybe this is an obvious question, but what do you do to learn, and how have incisions with lifting changed in the last 5-10 years? Have they?
Well, absolutely new techniques have come about, new ways to manipulate the breast tissue, and you pick these up by several ways. You go to meetings. You read about them in peer-reviewed journals, professional journals. You go to workshops, and then you go actually and spend time with some doctors who are actually doing the surgery. So it's not like you're starting from scratch. You're learning a new technique, but you already have that wisdom about how to treat and how to manipulate.
So the lift,
tissues.
by the way, is the trickiest or most technically demanding of all the breast procedures. Is that correct?
I would say so, yes. Mm-hmm.
Okay.
And that's because, of course, you need to know how much you're going to lift, and you need to want to get both breasts symmetrical.
Would you stack your incisions up against anybody out there?
Well, I think so. I think we have some very happy patients, and we take care to make sure that those patients stay happy by treating those incisions appropriately so that they're going to look good.
But with incisions in general, do you like to go always through the nipple area? What about the armpit? I'd like to know your thoughts there. Belly button, under the fold.
Well, let's talk about the belly button. There is a belly button approach, but you have to use saline implants. You can't use silicone because you have to put them in deflated.
Interesting.
Through a small little tube. And again, that omits the preference of using silicone gels.
You know, I should mention, I've had a few people approach me for interviews on the belly button technique. And I asked the doctor, I said, why, very well-known person here in San Diego, I said, why the belly button? They go, it's a great niche. Nobody else is doing it. And to me, I thought, that's the wrong answer. You know, it should have been, because that's where you get the best results, right?
Right.
So, I mean, what are your thoughts? I mean,
well, my thoughts are that since most of my patients want the silicones, and we can't offer that approach, but I certainly have been trained, and we have the equipment to do the belly button approach, but we have to use a saline implant. And the only problem with that approach is that it's what's called a closed pocket development. We're not sure we can't actually see where that
so it's not great for
going.
What, cleavage?
So, well, it may not be good for somebody certainly who has some drooping to begin with, because those are the patients that are going to need to be either under the muscle, the pocket opened a little bit, or the inframammary crease lowered appropriately, or perhaps even lifted. And then if you're going to make an incision to lift the breast, then why go through the belly button? Go through that same incision. So we're only dealing with one incision and not two.
Okay, so with women, and we're just about out of time, after pregnancy, drooping, they have stretch marks, go in for an evaluation.
Correct. Go into evaluation. Know everything that you can do. You don't have to do everything, but let the doctor evaluate you, and hopefully, of course, if you do come to us, we'll explain to you all your different options, what all of them mean, cost factors, obviously, recuperation time, and of course, expected results.
Now, 50 is very young today, but is that old for this kind of a procedure? To have a tummy tuck, breast augmentation, or lift altogether?
Absolutely not. You know, we're using the best and the latest type of anesthesia, and some of this can be done under local also. Some of the liposuction operations, but the point is we're using all the safest techniques. We get our patients mobilized very rapidly, and our complication rates have been continuing to decrease over the last several years.
Okay, tummy tuck, lipo, and breast augmentation, but you're also doing this special water jet lipo. Tell me what that is. Am I saying it right?
You are. It's called the body jet or the water jet.
Okay.
Or it's also referred to as water-assisted liposuction. And if you think of it, we're washing away the fat. But what we're doing with this new technique is in a very, very less traumatic technique. In other words, we're gently removing that fat away so that these patients have hardly any bruising, minimal swelling, and they feel great the next day. Number one. Number two is we're able to harvest that fat in a much, much more viable technique. And that's important because now we're starting to use that fat, re-injecting it into the buttock for buttock lifts, into the breast for that fullness in the upper part.
So you're injecting fat for breast now. Is that right?
In selected patients, we certainly are, and we're starting to see some excellent results without having to go through a formal operation with an implant.
All right. I want to thank you. Very interesting stuff. They could go to your website, find out more information. I want to thank you for coming on the show. Always a pleasure. Good stuff.
Okay,
Mommy
Randy.
Makeovers. Mommy Makeovers. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. You could also visit us on Facebook at Randy Alvarez and post your comments about Dr. Sherman. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.